So tomorrow is a test. We're gonna have to do written note and physical assessment. So physical assessment, I think I already recorded that. You can go back and listen to that. And for the written one, we have only 30 minutes to write down a systematic objective, what we see. So let's start. We will be given some height, weight, and BMI, maybe vital signs, and maybe mini mental score. That's all we're going to be given. We're going to have some patient. As soon as we will do the physical assessment, we'll come up. We'll have 30 minutes to write down this note. Let's do it. General. Alert and oriented times 4. Appropriate speech, responses, and attention, and eye contact. For the skin, appropriate to the ethnicity, warm, capillary refill less than 30 seconds, no discoloration or lesions, turgor is brisk, nails intact, no clapping. Hint. Head is normocephalic with no visible trauma, facial symmetry present, hair is clean, equally distributed, eyes are leveled symmetrically, no ptosis, lashes intact, no lesions or exudate, eyebrows aligned is symmetrical, sclera is white, conjunctiva is pink, no discharge or erythema, visual acuity and near vision is intact 20/20, Perla, EOM bilateral with no nystagmus, peripheral visual fields are full and intact, endoscopic exam reveals sharp disc margin, retina with no hemorrhaging or abnormalities, red reflex present, vessels are smooth, light reflex present, and positive. Ears are symmetrical, no abnormality in shape or size, no tenderness, tympanic membrane is pearly gray, no perforation or erythema or discharge, whisper test is intact, Rene normal, AC longer than BC, Weber test symmetrical, if we're gonna use that. Nose and septum are midline, no perforation noted, nasal mucosa is pink and moist, turbinates are intact, lips with no lesions symmetrical, oral mucosa is pink and moist, no lesions, exudate or erythema, tonsils are not visible, uvula midline and raises with saying ah, gag reflex are present, teeth are intact, neck and trachea are midline, thyroid is palpable, no tenderness, no nodules, no abnormality with swallowing maneuver, sinuses reveal no tenderness, lymph nodes are not enlarged and not tender. Respiratory effort is normal, no shortness of breath, retraction, deformity, or mass noted. AT is 1 to 2, no tenderness, respiratory expansion is symmetrical, tactile fremitus is normal and symmetrical, percussion reveals resonance bilaterally, no CVA tenderness, bilateral clear sounds anteriorly, posteriorly, and laterally. Cardiovascular. Precordium without mass, deformity, or tenderness, no peripheral edema, no thrills, heaves. Rhythm is regular, S1 and S2 present, no adventitious sounds. PMI is fifth intercostal space, mid-clavicular line, not displaced, no carotid, abdominal or renal bruits, Pulses are equal, 2 plus bilateral upper and lower extremities. GI. Abdomen is slightly rounded with no scar, masses, or pulsation. Vowel sounds are audible in all quadrants. Tympany over abdomen. Liver span 7 centimeters right midclavicular line and 1 centimeter below costal margin. No organomegaly. Musculoskeletal. Posture is erect. Normal curvature. Bilateral upper extremities without and lower extremities without deformity, muscle atrophy, tenderness, or crepitus. Full active range of motion of bilateral upper and lower extremities, spinal and lumbar spine as well. Symmetrical, no swelling or tenderness, full strength 5 out of 5 bilateral extremities, TMJ symmetrical, full range of motion, no tenderness or crepitus. Neurological. Patient is oriented and alert times 4, normal level of consciousness, cranial nerve 2 to the 12, all intact. Sensation is intact to soft, dull, and sharp objects. Coordination, proprioception, point to point, and rapid movements intact and symmetrical. Heel to shin and nose to finger. Rapid movements are normal. No pronation drift. Romberg test is negative. All reflexes are 2 plus and equal. Gait is steady. Tendon walk is intact. And monofilament intact in all location. Good luck.